in the life of a particular individual. So with that being said, I'm just highlighting the whole points that I have just talked to you, and I missed a few while I was talking. So a pharmacist can be a leader, like he can be a role model to his team members on how to serve any individual stepping to you for pharmaceutical care. Also, he plays the role of a manager. He has a team that needs to be managed. So even back in India too, I believe every pharmacy has a team leader, and he will be in charge of managing the whole pharmacy environment, making sure a smooth workflow is happening. And which is really important because one dull individual can change the whole mindset of a team, the whole practice of a team for that particular day. So you need to be a good leader along with a good managing skill as well. And there are times you need to make really bold decisions, like there are situations when you actually need to deny certain things, like you are a part of a team. You work with a lot of healthcare professionals. You can give your suggestions. You can make your opinion. So over here, every healthcare professional, they respect the word of a pharmacist too. So if being a pharmacist, if I make a stance about a medication, in effect, I provide necessary reasons to support my statement, then the other healthcare professionals are willing to make changes in the treatment. That's what basically I wanted to say. And also, a pharmacist is a teacher. You should be involved in a lot of teaching practices when it comes to medication, because we are the drug experts, basically. That's at least the competency levels will be different between individuals, but you are the expert in that particular area where you are practicing. At least in that area, you need to be confident enough to teach others and make your voice heard. So that's a gray area that you can do a lot better. And communicator. So you are acting like a bridge in between the healthcare professionals, basically. So the proper use of drugs, like when it, for example, when it comes to dosing calculations, especially in a hospital setup, the doctors, they just they just prescribe the medication, and you are the one who makes the as a pharmacist, you are the one who takes the decision to make the dosage, like if it's an IV infusion, the flow rates and everything. You make those things happening, and you communicate it with the nursing staff. So you come. I'm just giving you an example. So you should be in a position to communicate the things that you want to do in that particular area where you're practicing. So which is very important. So you need to make sure you are efficient enough to make those kind of stands. And all these things put together, I would say you are the ultimate caregiver. when it comes to the proper use of drugs, because a slight medication error or judgment error can sometimes cost the life of an individual, so which is very important. So even as mild duplication can cause significant issues, I mean, you need to feel that heat. That's what I'm trying to say. You need to feel motivated. You need to feel that you're empowered to make those kind of stands to provide better care for any patients coming to you, which is really important as a pharmacist. So I know I'm doing a lot of talking. I'm just gonna wind up my session really quick. Before that, I just wanted to share the various job opportunities that I have found for pharmacy graduates. It's just the ones that I have found over the course of time. There are still a lot of areas that you can find to work as a pharmacist. So these are the main areas that I have identified over the course of time. Coming to production, like formulations, then like medical devices, parenterals, raw materials. You can do a lot of those kind of stuffs in the production setup. Then marketing, which includes sales management, like promotion strategies, advertising, product management, then research and development, which I believe is a really big area where pharmacists play a significant role, especially because we are living in the midst of a pandemic, and the whole world is looking for a vaccine. And we hear a lot of news about a lot of vaccines being developed in different countries. And recently I read a news saying that a vaccine is on the phase 3 trials in India. So we do not know the authenticity of these news, but we play a significant role in new drug discovery. Then molecular modeling is an important area. Then bioinformatics, toxicology, biotechnology, all these comes under the research and development areas. That's all I could think about at this time. Then formulation and development, like I said, we can do a lot of research in developing new varieties of formulation, like immediate release and extended release formulation for the same drug, which can improve adherence in a lot of cases. Then clinical research, like I was talking about pharmacovigilance earlier. Then clinical trials, then clinical data management, which we can do effectively. Then operation room pharmacist, like you provide ambulatory care for patients. Then you act like an operation room organizer. I'm not sure if these are really we have these options. That's what I'm trying to tell you. We have these options available, and it's all about putting these into practice. Most of these options that I'm telling you, sometimes you wouldn't have even heard about it. I'm not trying to blame you or anything about it, but I'm just highlighting the options that I have found. So we have a lot of areas that we can work at. So I'm just giving you a rough idea about the main things that I have identified over the course of time. Then drugstore pharmacists, community pharmacists, that's what I'm doing at this time. And hospital pharmacists, definitely you are doing the rotations. any PharmD students in this meeting, they will be knowing about the roles of being a hospital pharmacist. Then critical care pharmacist, which is also an important growing area at this time. Like we have a lot of specializations in that particular area itself, like a lot of residency programs and cardiology, oncology, then intensive care unit pharmacist. So you have these options to learn and become an expert. Then nuclear pharmacist, again, the use of radioactive materials. It's a special brand. You need to be specifically trained to handle those kind of drugs on the first place. So developing those kind of medications and the proper use of those kind of medication, it needs its own set of competences, basically. Then analytical and quality control, which is a vital part in everything that we do. Like quality cannot be compromised. And when it comes to drugs, it is really, really important, because a slight error in the dosing can cause significant issues, basically. Then about the academics, like we have a lot of options in teaching, research, higher studies, consultants, then regulatory, like drug inspectors, drug registration filing, then like in the forensic department, then consulting, like another gray area, like you can be a master, like project handling, then data processing, all those kind of stuffs at the industrial level. Then drug information specialist. I mean, you are the main source of drug information wherever you are. So you're expected to know. Like I said, you won't be knowing everything, but you need to be an expert in that particular area where you are actually practicing. So that really matters a lot. Then military pharmacist, like Army pharmacist, Navy, Air Force pharmacist. Then you can do higher education, like you can do doctoral programs, then biotechnology courses, and we have a lot of options. Even in JSS, when I left JSS, I think we had around 13 different departments. 13 different branches where you can become an expert in the pharmacy profession itself. Then building businesses, that's another gray area. Like you have the option to build a pharma unit, like retail businesses, and develop your own business. What I'm thinking is, when you start all these kind of businesses, you should not think in that perspective that you wanted to make a lot of money. So when you're thinking about money only, then you fail to recognize the fact that you are that kind of a profession who is required to show empathy to patients. So when money comes your priority, when money becomes your priority, you fail to live those kind of responsibilities that is entrusted upon you. So business setup is also it's also an area where you can actually grow yourself in your profession. And there are options of doing medical transcription, then I would say project management, medical coding, those are the areas where you can actually work on as a pharmacist. I mean, that's what I have found so far. I mean, those are the gray areas that you can mold yourself, specialize yourself to become a better pharmacist. And with that being said, I would like to wind up my presentation, and I will be open for any sort of discussion at this time.
So thank you, Amal, for your experience and what you have learned while you have worked there, to the students of PharmD and others who are listening to this presentation. So now the session is open for discussion. So anyone who have anything to be clear, you can ask. So those who want to ask any questions, you can unlock your mic and you can continue. So if you are not having any doubt, I think we can wind up the session. I should have to thank Emil Sunny Abraham for this nice presentation. And for him, the time is around 2 o'clock. And because of the invitation, he has accepted to give this presentation. Thank you, Emil.
Thank you, sir. Thank you.
So, is it a time to compliment Emil? So this is Rajendra.
Yeah. You can go ahead.
Emil, this is of course a pleasant morning. Okay, right now it's almost 11:50 at India.